NCRGEA members and guests, and welcome to today's webinar, all about long-term care and elderly care. This is the fifth in a series of NCRGEA Lunch and Learn monthly webinars. I'm your host, Tom McCullum, and I'll be joined today by Tim O'Connell, NCRGEA's Executive Director, who will provide you with an update on the association's activities. John Green from our partner AMBA is our main presenter. You may remember John from our July Lunch and Learn when he spoke about Passport and MASA. John will be assisted by Tony Prince, AMBA's Director of Virtual Enrollment. Many of you may recognize Tony from our district conferences, where his presentations and information table has been ranked by attendees among the most popular for information and service. Before we begin this webinar, I want to go over a few items. Each of you have been muted to help ensure the presenters can be heard. This session will be recorded. Links for this session will be emailed to you as well as posted on our webpage and social media sites. If you have a question, please use the chat icon at the bottom of your page. With this, you can write your question and send it to us. We'll try to respond to you through the chat during the webinar, but if not, we'll read each question at the end so John, Tony, or Tim can answer. However, if there are any specific ones that cannot be answered, we will ensure you receive a follow-up communication that addresses those responses. We'll also be posting questions through our poll feature during the conference that you can answer. We do this to help emphasize important points and to help our presenters know who they are talking to. Lastly, we'll be sending each of you a link to a survey about today's webinar. The intent of the survey is to get your feedback so we know you're meeting your needs and expectations. The survey is quick and easy to complete. Just get it back to us by Monday. So without further ado, here's Tim O'Connell, NCRGEA's Executive Director.
Hey, good afternoon, everyone. Great to have you here. So excited about this program. Very relevant topic to a lot of us as both potential users of it, and then also maybe there's a loved one in your family that you're looking at this type of program as well. So thank you, AMBA, for providing this. I'm going to quickly share a little bit about what has been going on here at NCRGEA. So one big thing I always like to start with is thank you for your membership. It makes a difference and it made a difference. And I'll share a little bit on why and how it made a difference here in a moment. What has been going on is you're hearing a lot from the legislature. So I'm going to start with actually sharing about local government, and then I'm going to go into sharing about what's going on with for state employees in the legislature. Local government wise, I want you to know this, that you are very important to us. The decisions on any COLA or bonuses are made annually each year by the Board of Trustees, not the legislature. So if that is sometimes not a known fact, but the January meeting of the Board of Trustees for the local government retirement system is the most important meeting of the year for you. I like to think of it as the Super Bowl. We go in there and we are getting ready right now for that meeting. So know that I hope to have good news for you after that meeting in January. State government, I want to share a little bit with you as well. This is what's been going on with our organization. We have been working hard for you as well. And so one moment, I'm sorry, I'm grabbing slides here from my share screen and it's suddenly disappeared. There it goes. All right, sorry about that. Coming back to you. All right, so the big news on the state level, there's been a 4% increase. That is a bonus, that is a one-time bonus that is being provided by the legislature. That is a amount that will be delivered to you in your November disbursements coming from the retirement system. That is for state employees at this time. And as I mentioned, local government, the decision for yours is going to be in January of 2024. The two areas that I want you to know that how you made a difference through membership is, one is through your advocacy. We began doing some programs where you could communicate through call to actions to the legislature. And one of those things, the tool is called Fast Democracy. we put out a email to you all to say, please write to your legislators. And in total, this is just 1 week, and in total, we had about 6,000 of you participate and send communication to the legislature. And that did make a difference. So our lobbyists, we have a team of 4 lobbyists, they were out there. And then when your messages to your legislatures arrived, that really showed the kind of numbers we have. So really want you to know that it made a difference, and that's how membership makes a difference. If you need more information on fast democracy, the tools or the bill tracker, it's on our website. And that tool is there and available for you. And then the other tool I want you to know about is on our website, we do regular updates from the legislature. Jessica Proctor is, you'll see her on our website, but she shares the information coming out of the legislature. So that's a important tool and an easy way to find out what's going on internally for you. This past year, we really have engaged in a lot of lobbying and advocacy work. We had a breakfast for new legislators. We've had a lot of one-on-one and introductory meetings with legislators. And we, just so know, we are truly a nonpartisan party. We work both sides of the aisles, and I always like to share some pictures. We have Representative Reeves right there, and he's meeting with Kari and myself, great supporter. And then we also met with Speaker Moore, also a great supporter of our organization. So it takes a lot of work to deliver on the promises that the legislators have made, and we make sure they do that through our lobbying and legislative work. So more to come on this. We are always working. We are working right now towards getting local government a good return from that January meeting. So if there's any questions, please drop them into the chat box. I'm an easy one to reach out to. I'm Tim, T-I-M, at NCRGEA.com. We'll put that also in the chat box. And I'll be glad to answer questions during this meeting if you have them specifically on these topics I've just shared on. So thank you again for your membership, and I'm looking forward to this program.
Thanks, Tim. As you can see, the association is busy advocating for all of our members, both local government and state employees. Now I'd like to present John Green and Tony Prince with AMBA.
Thank you, Tom. Appreciate that. Again, my name is John Green with Association Member Benefits Advisors, or better known as AMBA, joined by Tony Prince today. Thank you very much for being here. We're going to talk all about long-term care from a wide variety of different angles. Going to do it from a very high-level overview standpoint. That way that you can, have your chance to answer questions, things like that. I appreciate the questions that you've sent in beforehand. But just a real quick introduction. I live a little bit north of Houston with my wife, who's an elementary school teacher. I am a product of a public employee household. My grandfather, my aunt, and my mother all worked for the Texas Highway Department. My grandfather retired from the Highway Department, loved his time of service there. So thank you for taking care of your fellow North Carolina citizens. I am a huge Baylor Bear fan. Love to follow my Bears in basketball and football. So looking forward to some of our basketball matchups with those great teams in North Carolina this coming winter. And just want to reintroduce AMBA to you as well. I know that maybe some of you have been out and about with AMBA and noticed Tony and his team out in some of your community meetings. So thank you for attending that. At AMBA, we serve over 450 associations. About 80 of them are very similar to NCRGEA, retired public servants. And we thank you again so much for your service and many, many opportunities to serve you. Tony is in charge of our North Carolina operation, and he'll be the one that you talk to as you have your comments and questions about long-term care as we go through here. But today, our goals are to kind of talk about the myths and facts surrounding the need for any type of extended care, long-term care, elderly care, however you want to call it. We're going to discuss the needs for it from a traditional number standpoint. We're going to talk about the components of a traditional long-term care plan. Many of you wrote in and said, hey, I have a long-term care plan. What about this? We're going to talk about that as we go through this conversation here in just a moment. Then we're going to talk about the costs of care, especially in North Carolina, and kind of show you what the numbers look like today, some of your solutions that are out there. But to help Tony and I understand who is on this conversation today, Patty's going to launch a quick poll for us, and I want to get your response. So if you'll just vote on this, it's totally anonymous. When you need long-term care or somebody to take care of you at home or in a nursing facility, what's your plan? If you'll answer that question for us, how you're going to spend, either spend your own personal savings for your care, if you're going to rely on friends and family to take care of you, if you have your own long-term care policy, which many of you did write in and say that you had, or talk about Medicaid, or I'm not sure what I'm going to do. If there are some of you on here being honest about that, then I appreciate you doing that. So just answer that question there. Patty's going to kind of give us a heads up and let us know what things look like. So Patty, just you keep it open as long as you think as people are voting, and then we'll share the results, and that'll help Tony and I understand who's on the call today and direct our questions and our answers and our conversation to that to the poll question. All right, so we've got good responses here. So about 40% of you said, I don't know what I'm going to do. And I appreciate and applaud the honesty there. Thank you very much for that. About a quarter of you said you're going to spend your own personal savings. A few of you said you're going to rely on your friends and family. A good 30% of you said, I have a long-term care plan of some sort. And I applaud you, because my family's trajectory was changed because of a plan that my father had taken out many, many years ago. So Patty, thank you very much for sharing that. We're going to move right on through here and have this conversation, because as I mentioned, this is why I'm so passionate about this. Tim and I both share this passion about this. This is a photo of my father. It was July of 2020. This was over in Austin, Texas. This was near his 80th birthday, and it was the last time that my father remembered who I was. He had been in a nursing facility for about 2.5 years as the result of vascular dementia. And he passed away. It'll be 3 years tomorrow. He passed away. And because of what he did many years ago in taking out a long-term care policy, it allowed my family, my stepmother, my grandkids to maintain their standard of living, because we didn't have to worry that he was not going to get the best care. And so this conversation that we roll through here today talks about my experiences with what my father's situation was, and I'll show you how long-term care worked for him. I'll show you how it doesn't work, how Medicare works. We're going to answer a lot of those questions that you brought in, and you had tremendous questions that you brought in. Many of you asked about, do I even need some type of long-term care? How do they work? Am I too old to purchase a long-term care plan? Or a lot of you, and it showed out there on the poll, I have a long-term care policy already, but my rates keep going up. What do I do? We're going to show you what you can do and kind of give you some advice. And because we are recording this conversation, I want to put this disclaimer out there. If you have a plan, please, please, please hear me out. Do not cancel your plan. You may have options built in your policy, that you may have some other benefits that you've earned. Let someone review it first. And so please make sure that you do that. And everyone's situation is different. That's why it's so important to have someone review that, and Tony and his team can help you out as well. Some of the questions came in about pre-existing health conditions and qualifications. There are different plans depending upon your health, that type of thing. Can I get care in my home? Do I have to go to a nursing home? So many different yeses and nos in here. We're going to address these things as we go through here. Talk about Medicare, how it works with Medicare, what is long-term care covered in Medicare, about Medicaid, because we got some questions about Medicaid, and some really good, had some great testimonials that came in talking about how Medicaid did and didn't work for them. So we're going to address that as well. And if there are any alternatives to long-term care, and there are some out there. So again, thank you so much for these questions. We're going to address all of these as we go through here. If there's something we didn't touch on, please put it in the chat, put it in the Q&A. Tony or someone else from the NCRGEA team can address that as we go through here as well. But just a quick history lesson, and kind of to get to where we are at this point right now. And this is probably why we had so many of you say, I had a long-term care policy, or I still have it. Back in the early 90s, people started seeing what happened to their parents and their grandparents. And they started seeing, oh my gosh, the cost of taking care of mom or dad was pretty expensive. So companies started offering long-term care policies, and many of them started offering them through the workplace. Down here in the state of Texas, like I said, where my grandfather and my mom worked, the state of Texas offered access to a long-term care plan. And so you saw throughout all the 90s and through the early 2000s, a significant rise in the number of people who bought long-term care policies. And then all of a sudden, there were a lot of claims on those policies, and companies turned around and said, we can't write long-term care insurance anymore. So they stopped writing it, especially through a workplace setting. They started raising rates, they tightened up their underwriting guidelines. And so we saw a significant decline in long-term care policies out there. And you may find yourself there as well. There is some good news, bad news out there when it comes to care right now. The good news is the advancements in diagnosis and treatment are driving life expectancies up. We're catching things earlier. We're avoiding some issues, things like that. And advanced procedures are getting people back on their feet. And so care is being provided in a much quicker manner, and we're able to avoid that need right as well. And there are so many more options of care that are out there. There are specialty facilities just for memory care, like my father was in. There are assisted living facilities. There are centers all across the country, especially in the Carolinas and the South, that are centered around, all aspects of living, whether you have to have someone come in and take care of you, or how you can just participate in certain activities but need still help on therapy, things like that. A lot of varieties out there. On the flip side, because we are aging as a population, the need comes up and then the cost goes up as a result of that. And we're seeing a smaller family care pool. What that means is, I think about my grandparents. All four of my grandparents were one of 7 to 12 kids. And so if somebody needed care in the family, there was somebody, a brother or sister or a in-law, that could take care of that. And now these days we have smaller families with 1 or 2 children in them. So the number of people who can take care of us in our home is much smaller. Companies have kind of changed the language in their policies. At the same time, Medicare has made significant changes in their policies. Even if you're on some type of an advantage plan through the state employment, through your county, something like that, those Medicare changes impact all the way down. We're going to talk about that. So there's been an increase in coverage premiums, larger elimination periods. We're going to talk about that. And then the effect of COVID had on nursing homes was huge. I didn't realize my father was in the nursing home, started in 2020, and then COVID, came in not too long after that. And how many shared services that nursing homes had, meaning they had therapists that would rotate around, or nutritionists that would rotate around to multiple facilities. Well, what happened when COVID came in was the government said you can't move around, you can't share this staff to try to make sure that COVID didn't spread throughout different facilities. So that caused prices to go up and services to change as well. So a lot of things happen, and you may find yourself right now, especially that 30% of you that has a policy already, you're starting to see pretty sizable rate increases on pre-existing policies. And you ask, what do I do? We're going to talk about that in just a moment. Some carriers have come back and said, we will levelize your premium. We'll hold your premium steady, but we want to reduce your coverage. And that's an option that you may have. You may not want to take that option. We're also seeing people that took out a policy many years ago with a large elimination period. I'm going to define that in just a moment. That now they realize that's a lot of money out of their pocket that they're going to have to pay before they can even get coverage on their policy, or they find that their policy doesn't match what the needs are going to be in the future. And so some of those benefits could be restrictive, especially if you want home care. You may not be able to get care where you want to. So we're going to dive in and kind of break down some of the policy things. But what I want you to do is grab a pen and paper real quickly. I'm going to give you some numbers, because there's the important thing about long-term care. As broad as all these changes have affected people, it really matters how it affects you and what your need could be or what your need is already. So take a look at some of these numbers here. First of all, the fact that no matter what changes, no matter what the situation is, once we reach age 65, 70% of us are going to need some form of extended care in our lifetime. Now, that doesn't mean, like my father, the last 2 years of his life. That could mean that you have a hip replacement surgery and you need to have someone come to your home and give you physical therapy 3 days a week, something like that. Or it could be Alzheimer's and somebody spends 8-9 years in a facility or at home. So 70% is a pretty sizable number of us that are going to need care for an extended period of time, sometime in our lifetime. And here are some numbers right now that we've done a little research to kind of find out what the average times are, so that you can, as you're sitting in there making a plan, or you're looking at your plan and say, here's what I have, here's where I think I need, here's what the numbers are right now. 28 months, a little less than 2.5 years, is the average time that someone spends in an assisted living facility. That's kind of that halfway point between your home and a nursing home. but almost 60% of those people who start in an assisted living facility will end up in a skilled nursing facility, or what we'd call a nursing home. Now, the average stay overall in a nursing home is 2.2 years. Men stay in much less than women. But if you've got a history of Alzheimer's in your family, the average Alzheimer's stay in a nursing home is 9 years. I met many Alzheimer's patients in my father's first facility that he stayed in that had been there 5, 6, 7 years because of Alzheimer's. Their body was totally healthy otherwise. They just couldn't take care of themselves because of Alzheimer's. So if you've got a history of that in your family, that's something you need to think about out there. But the number I want you to write down is 100. Just write down 100 on a piece of paper there, because I was shocked when I found out that almost half of all nursing home residents stay less than 100 days in a nursing facility. And that's not because they pass away. We're going to talk about what that 100 number is in just a moment, but write that number down because that's a crucial number. So when we talk about long-term care, and for the 30% of you who have a long-term care policy, this is very important to understand what makes up a long-term care plan. So I want to illustrate this kind of like the making of a good hamburger. If you just have the meat, that's basically a ground chop steak or whatever you want to call that. But a good hamburger consists of buns and all of the stuff inside of it. And a good long-term care policy is just like a good hamburger. You can customize it with certain things to make it fit your need. So if you have a long-term care policy, or you're looking at a long-term care policy, what usually you want to look at first and foremost is what triggers my benefit, meaning how do I go on claim if I need to have care? Well, that's where the buns come in. And the first thing that usually will trigger a long-term care policy is what's called an activity of daily living. Most policies list out 6 or 7 of them, and you have to lose 2 or 3 of those activities of daily living, such as bathing, toileting, being able to wipe your backside, feed yourself, transfer, get dressed, things like that. If you lose 2 or 3 of those activities of daily living, then you start to claim your benefits. Or a cognitive impairment like dementia or Alzheimer's. So in the case of my father's situation, in his early dementia, he could do all of his activities of daily living, but he was at risk to wander off, or at risk to get up in the middle of the night and pretend to be an electrician, which he had no skills in electrical work. So that's where a claim can start at that point. So once you have a qualification, or the buns that make up the hamburger, the qualifications to trigger your long-term care policy, then is when the meat comes in, and that's your daily benefit amount or a pool of money. Some policies are written with $100, $200, $300 a day worth of coverage, or some have a pool of money that says you've got X number of tens or hundreds of thousands of dollars. Then your length of coverage comes in. If you have a daily benefit amount, it will say you get X number of dollars a day for 3 years, 5 years, or for your life. If you have a pool of money, it will say you get this amount of money until it runs out. Neither one is better than the other. It's just sometimes they're sold a little differently, so they may be a little less expensive on one or the other. But that's how the meat and the cheese, so to speak, those things come in your long-term care policy as far as the type of benefit. Then you start to add your options or the ways that you can vary the policy. One of them is through an elimination period. In an elimination period, think about your deductible on your homeowner's insurance policy, especially for those of you living on the Carolina coast. When a storm comes in, the deductible on your homeowner's policy says you have to pay the first 1%, 2%, $1,000, whatever it is, of damage before your insurance company pays for the rest. The elimination period works the same way with a traditional long-term care policy. It says you have to pay for the first 30, 60, 90 days of your own care before the policy kicks in. So if you've got a 90-day elimination period on your policy, what that means is you're responsible for the first 90 days of your care before the policy starts to pay out on that. So again, that's important to understand what's out there for you. Then you start to pull in things such as location of coverage, inflation protection, and non-skilled services. Some policies say you can be taken care of only in a nursing home. Others will say you can be cared for at home or in a nursing home, but not an assisted living facility. Others allow you to get cared for wherever you want to. So again, you could pick and choose that. Some policies have inflation protection in there. And I want to spend just a second on this because this is very important for those of you who have a plan already. Inflation protection really protects you. I think about my father. He purchased his plan back 20 plus years before he needed his plan. He was healthy. He had run track at University of Oklahoma, played competitive basketball well into his early 60s. And he bought his plan then for, I want to say it was a couple $100 a day. But he put an inflation protection rider on there, which grew it at 5% every year. Some plans offer that. Some plans will offer you inflation protection every year, and they'll send you a letter, and it'll say for an extra $5 a month, you can add this much onto your coverage. Yes or no, and you sign yes or no and send it back. If you sign no, they say no problem. Next year, they're going to send you another letter that says, would you like to add inflation protection on your policy this year for X number of dollars? If you say no twice, most plans will no longer offer you that inflation protection. And you could be 20 years down the road and your plan doesn't meet up to what you think it needs. So again, it's important to have someone review that, and Tony and his team can help you out there. And then finally, one of the components of a traditional long-term care plan is what I call non-skilled services. Some plans are very restrictive and say you can only be cared for in a skilled nursing facility or by a licensed home health nurse to come out to your home. Some plans offer coverage or money that you can use however you want to have someone non-skilled take care of you, meaning they could do some light housework, some cooking or cleaning, or the ability to transfer you out of the bed into a wheelchair or something like that. Or in the case of my father, early on, my stepmother still worked, and my father would get up in the middle of the night and wander off. We were able to bring someone in with my father's long-term care plan, non-skilled, that basically just set up with my dad in the middle of the night to make sure he didn't wander off and hurt himself. So again, that's the components of a long-term care plan. Here's kind of how it looks on paper. This is a sample plan that was offered in the state of Texas, very similar to states all across the country for public employees. So I don't know if you had one like this from John Hancock, a very strong, reputable company. They no longer offer this plan. Most carriers have stopped offering group long-term care plans through state employment, but it basically shows you in here what your coverage amount is. This is a daily benefit amount, maximum of $300 a day for a nursing home, $300 a day for an alternative care facility like an adult daycare or maybe even an assisted living facility. Community-based care, this is assisted living facility at $225. Informal care, again, this would be for someone to sit up and stay with somebody that was a flight risk, something like that, $75 a day, maximum of $2,250. So again, it didn't have a lot of coverage in there for non-skilled care. This has a pool of money of $657,000 maximum lifetime benefit. So once those $300 days wrap out at $657,000, it's over. The maximum stay-at-home lifetime benefit is only $9,000. So this is pretty skinny on the at-home benefits, pretty robust on the nursing home benefits. It has that 90-day qualification or elimination provision, meaning they have to pay the first 90 days of their time in a nursing home or an assisted living facility, and it qualifies once you lose 2 activities of daily living out there. So that's what a sample plan looks like. Let's get in a little deeper and talk about what is extended care. Extended care does not have to be like my father's final years in a nursing home or a long-term care facility. It can be care in your home. It could be care in an assisted living community. There are communities that are centered around religious organizations or churches, some around fraternal organizations like Elks Club or the Shriners or the Masonic Lodge, things like that. Some are even centered around professions. There are facilities in Texas that are just for retired teachers. So there's all different type of care facilities out there, and they're wide and they're growing quite a bit. A lot that you can purchase your unit, for lack of a better term, and as you need care, you get progressive care as you go along. So some really neat ways out there because you never know when you're going to need it. As we age, things get to be harder for us, and you could need it at that point. I never expected my father to ever need long-term care. He was the most healthy individual I ever knew. And then he had a series of small strokes leading up to a bigger stroke, which led to the vascular dementia and caused us to need to put him into a nursing home after a while. But in the first facility that he was in, I noticed that there were people there younger than me, and I was in my early 50s when he was in the first facility. And I'd asked kind of the nurses and the aides around there, so what's the situation? They said, this person had an accident, had a traumatic brain injury, or a fall, something like that. So you never know when you're going to need long-term care. It doesn't necessarily mean it's always for someone that's old. And so it's important to understand that as you prepare as well. And just as there are many ways to get care, there are many ways to pay for extended care. And we talked about that in our poll question. Most people will do the first two. They'll pull from their personal savings or they'll rely on their friends and family. Some will try to go into the Medicaid program. We're going to talk about that in just a moment. And then 30% of you, a large group of us on the call today, have some form of extended care coverage. It doesn't matter what you call it. You can call it long-term care, you can call it home health care, you can call it nursing home care. It doesn't matter. It gives you the money that you can use to give you the peace of mind for what you need. Now, there are some myths, and you probably hear these myths at church, sitting around the coffee at church or in your Sunday school class or with some friends at the community center, that health insurance covers all my long-term care needs, or that Medicare is going to cover it, or that Medicare and Medicaid are the same, or I'm too young to buy. We hear a lot of these myths all the time. I'm going to kind of walk you through and dispel some of those myths so we can answer those and make sure that you've got every question answered as we go through here, because long-term care is such an expensive proposition. Medicare and health insurance, no matter where you get it from, are not designed to cover that. Mutual of Omaha is a very reputable carrier. And when you think Mutual of Omaha, if you're like me, I think about Marlon Perkins and Jim out there on the African plains chasing down lions and big snakes and things like that. But that's the same company that used to sponsor Wild Kingdom. They gave us some stats, and they said that the average person who goes on claim is age 78, and overwhelmingly more women than men go on long-term care claim than the men do. And that's usually because the man stays at home and the woman wears herself out taking care of him. He passes away, and then she has to have long-term care in that regards. Top 3 reasons for needing care: dementia, heart disease, and arthritis. Arthritis surprised me, but you're not able to do things, not able to dress yourself, feed yourself with severe arthritis, things of that nature. So those are some of the stats there. So when you look at those stats and match them up with the numbers we shared with you earlier, you start to get a picture of how this could work for you. Could it impact you based on your family history, your own medical history as well? And the services that are provided don't mean that you always have to go to a nursing home. If you want to be cared for in a home, a proper plan can give you finances to take care of yourself in a home or in a community or an assisted living facility. Or in the case of my father, we kept him at home as long as possible until my stepmother could no longer provide the care that he needed. And he needed to be in a 24-hour around-the-clock skilled nursing facility where he could get good physical therapy, good interaction, good nutrition, and someone could take care of him if he had medical needs at all times. So again, a good plan provides for those things all the way around. That long-term care plan allowed my family to supplement any out-of-pocket expenses that he might have, which were very minimal because he had a very good plan. Most importantly, it protected the assets that my father had worked all his career to take care of my stepmother so that she could stay in her home. Also, to take care of my kids, his grandkids, because we didn't have to take care of my father by taking money out of our kids' college savings fund. A good long-term care plan protects those assets. And most importantly, a good long-term care plan probably kept my father at home for at least 2 years, longer than necessary or longer than possible, because we were able to have some home care provided for him. It kept him in a familiar surrounding until we had to make that difficult decision that he could no longer be cared for as well unless he was in a nursing facility. And it allowed us to get a facility that was a very good facility, that my stepmother could go see him frequently and I could go see him when I was in Austin. So it allowed us to keep my dad at home with the things that mattered the most and connected that way. And part of that was because of the stay-at-home benefits. A good long-term care policy can provide those stay-at-home benefits for light housekeeping, personal tasks like bathing and dressing, even a visiting nurse to come provide some home health needs, whether it be dressing bandages, helping with physical therapy, administer medications, things like that. And a good care policy, of, however you design it, can help with widening doors, putting ramps in the house or up to the house, or even getting equipment like lift beds and things like that. All of those things are designed to keep you at home. A good plan can do that. So that's the nice peace of mind thing about a good long-term care plan. No matter how you define it, it allows you to keep those things that you're most connected to and keep you in front of that. So let's look at the costs of plans out there. The costs of plans vary all across the board. These are some national numbers out there, and you can see the growth that they've had over the past decade or so. It's about $27 an hour for a home health aide to come out to the home. For an assisted living facility, for somebody that lives in a in a private apartment where you're able to use, all the facilities, use all of the meals, and then have somebody check on you and do a few things for you, it's about $4,800 on a national basis. That's gone up over 50% in the past decade. More and more people want to go into those type of facilities. Then you get into the semi-private and private rooms in a nursing facility, and you see those costs nationally are over $8,000 and $9,000 respectively. For my father 3 years ago, it was around $6,000 a month for a semi-private room in Texas, in what I would consider a very good facility, not the Taj Mahal by any stretch of the imagination, but a very good facility. And so you can see it can be quite costly, and those are growing out there. So I wanted to do a little bit of research just in North Carolina to kind of give you a feel across the board what those costs could be. I went out to genworth.com, GENWORTH.com. You can go out there yourself. I encourage you to write that down. You can scroll down a little bit further, and there is on their first homepage is a cost of care calculator. All you have to do is put in the city, the zip, the state, whatever you want to do, and get as close as you want to, and it will show you what the costs are in your area for home health aid, assisted living, semi-private, and a private room in a nursing home. And you can see in North Carolina, those costs are a little bit less expensive than the national average, but they're not cheap by any estimation. You see, it's anywhere from about $4,700 to $4,900 for a home health aid. Assisted living facilities, depending on where they are. You get in Charlotte, there's probably more assisted living facilities around the Charlotte area, so it's a little bit less expensive out there. Nursing home facilities, probably about what it is in Texas, about that average for semi-private and a private room. So I encourage you to go out to genworth.com, take a look at that, and think about it from the standpoint of, all right, if I live in Raleigh, it's about $7,000 a month for a semi-private room. Okay, do I have that much money a month saved up, or is my pension going to fulfill that amount? Because oftentimes people say, well, if you have to go to a nursing home, can I do anything with my pension? Well, you can't call the pension board and say, raise my pension. I have to go to a nursing home facility. So how will you pay? You can use your personal savings. The problem with that is sometimes that first dollar is very hard to find. You can't call the pension board and say, increase my pension. You may have some money that you've saved away in some type of a 401k, an IRA, or something like that. And selling that may mean that you have to trigger some tax consequences, or you're selling it at a low value because you've lost money in the stock market over the past year or two. Those are some things that are out there. Some people we find say they sit around that table and each brother and sister have to come up with money to take care of mom or dad, that type of thing. Those things are out there for real. Then some people say, let's go on Medicaid. I can tell you Medicaid is truly a last resort situation. It is for people with very limited assets. What we find is that individuals who have a pension usually do not qualify because the pension keeps them above the poverty level, even though it may not be very large. You have to spend down your assets. They do a 5-year look back. And then even after you pass away, even if you qualified for Medicaid, the state will come back and seek reimbursement from your estate. And this is a testimonial we received from one of your members that said, my spouse had major health problems that led them to go into a Medicaid facility. She gets to stay at home as long as she lives, but once she passes away, her estate has to pay $95,000 back to Medicaid for the care of her husband. So that could put everything that you plan to pass down to the grandkids, the kids, at Lurch as well. So Medicaid is really a truly last resort situation. The first facility where my father was, they had 3 wings. 2 of those wings were for private payers, meaning that they had long-term care, they were paying out of their own assets. Those wings had very high patient to staff ratios, great care, lots of activities, things like that. Then there was the Medicaid wing. That Medicaid wing would not be somewhere where I wanted to place my father or loved one. So I don't always encourage people to think about Medicaid as a resort, as an option, because it is so difficult to qualify for, and it may not be the type of care that you want out there. Now, a few of you said, I'm going to rely on my family and friends. Those of you are probably the most honest individuals that on this conversation today. That's because studies have found that no matter how we plan, no matter what we do, almost 3/4 of all long-term care is done in an informal setting by an informal caregiver who receives 0 compensation. And really what that means is that kids or spouses are having to take care of the loved one who needs that care. And unfortunately, this falls more on women than men. It's usually the daughters and daughter-in-laws who have to quit their job or have to change their hours to take care of mom and dad. And that can stunt their income, not only providing for the household, but it can also stunt their pension income if they're on any type of pension plan, because some people have to stop their jobs or quit their jobs early to take care of a loved one, and that can stunt their pension over a period of time. But really, the impact on your family of long-term care is greater than the financial need. It has a significant impact on your health with depression, can impact relationships with spouses. So many different things. We see oftentimes divorces take place because there's so much need for care of a parent that you neglect the family back at home. And not only the financial aspects of it, but missing work, working fewer hours, the emotional burnout. We're seeing churches step up with caregiver ministries, things like that. So taking care of your own long-term care needs from a financial perspective not only gives you peace of mind, it protects your family and your loved ones as well, so that the decisions they have to make are only about the quality of your care and not about the financial aspects of your care and how it can impact the generations to come. Now let's talk about Medicare, because we've got a lot of questions about Medicare. How does it work? How does Medicare, and when I say Medicare, I'm talking about any healthcare plan after age 65. Because all of those plans are driven off of Medicare rules, even if you're on a Medicare Advantage plan or some type of state plan that uses a Medicare Advantage network, things like that. Medicare will pay for long-term care, but only after a 3-day inpatient hospital stay. So I want you to write down the word inpatient. It has to be at a skilled nursing facility. So it can't be at home. It's got to be at a skilled nursing facility. Medicare will pay for the first 100 days. It should be 100% for the first 20 days. After that, you're going to have a $200 per day coinsurance payment that you'll be responsible for. And then after 100 days, Medicare stops paying altogether, and you're 100% responsible at that point. Now, I ask you to write down 3 days and inpatient. That word inpatient is so crucial because every year Medicare makes changes to what they call inpatient care versus outpatient care or outpatient status. Anytime you go into a hospital, there are billing codes for your procedure. Think a 6-digit code or a 12-digit code for your hip replacement surgery, or a fall, or you have to have a shoulder and a knee replaced, something like that. There is a code. That code does not determine the type of care you get in the hospital. You could stay 3 days in the hospital, have your knee replaced, but if it's an inpatient code, you have all of those skilled nursing care after you get discharged. If it's an outpatient code, you get none of those outpatient after the skilled care because it's an outpatient status. If your procedure is an inpatient procedure and you stay at least 3 nights, all of those Medicare provisions kick in. If you stay in the hospital more than 3 nights or 3 nights or more, but it's an observation status or an outpatient procedure, you get none of those. And every year, Medicare moves thousands of procedures from the inpatient care side to the outpatient care side. And what that does is it saves Medicare billions of dollars on aftercare, that long-term care, that recovery care, that skilled care. That's where Medicare saves their money. So again, what may have given you coverage in the past for certain periods of time may not in the future, because Medicare changes that all the time. And then what happens if you don't get better? In the case of my father, his very last stroke that he had, that we had to then put him in a nursing home facility after that, he went to that nursing facility that for the first 20 days, where they were trying to get him back on his feet, learn how to feed himself, dress himself, walk again. About day 18, they said he's not going to be able to get any better. Immediately, that facility says Medicare is no longer paying. You've got to find somewhere who's going to take care of your father. Once you become chronic, that's how Medicare qualifies you, meaning you're not going to get better. Medicare stops paying altogether regardless. So remember, I asked you back early on to look at that 100-day number, write that down. That's why almost 50% of people who go to a nursing home come out before 100 days, because once they stop getting better, Medicare cuts off funding and they have to be responsible on their own. So now you can understand how that works, hopefully. Now we get a lot of common concerns, and these questions came in for us. I'm too old. The good news is there are plans available to you up to age 89. So you're almost never too old. I have health issues. There are some plans that have less restrictive qualifications. You don't have to worry about maybe some past incidents, things like that, or health issues. Then people said, and there's 30% of you that said, I've got a long-term care policy, but my plan premiums keep going up and up and up. Don't cancel. Let's review it. Let Tony and his team review that plan, because you may have some options built in your policy, some benefits that you've earned that you don't want to let go of. So it's super, super important that you have someone review that plan for you. And there are other options out there. There are options for shorter periods of time. If finances are a situation for you, length of coverage can be much shorter. For example, I have a plan for my mother that is 1 year in length, that will pay her X number of $1,000 per week, that if she needs care, she's going to be taken care of. But after a year, my brother and I will be responsible for her. So that allows us to get her affairs in order. So there's length of coverage things that are there. There are daily benefit amounts that you can go smaller or higher, depending upon your budget. There are plans that will just cover that elimination period, just 90 days. So again, it can save you money that as well. Some plans that give you peace of mind that you can get cared for at home in an assisted living facility or in a long-term care facility. And then finally, the one that I like, some plans will give you money that you can use non-skilled services, meaning you can just have someone come out and take care of you if you need to have care in your home. Again, there are options that are out there for you. I'd highly encourage you, take advantage of your endorsed options from NCRGEA to find out about these situations for you. Now, I'm a big fan of Dave Ramsey, and I'm sure Dave Ramsey's on a lot of radio stations and TVs all across North Carolina. And he says, someone called in here recently, says, can I self-insure for my long-term care needs? Like, can I pay for it out of my own pocket? And Dave says, absolutely you can. If you have a net worth of $4 million or more, then you can afford to self-insure for long-term care. Now, most of us don't have a net worth of $4 million or more. So David says, long-term care allows you to live in your home longer. You won't be a burden on your family and friends. They'll be able to come love on you without having to worry about the health aspects and the financial aspects of taking care of you. And you have a plan. I am so thankful that my father took out a plan many, many years ago, because it allowed us to focus on his needs and not having to worry about the financial aspects of taking care of my stepmother, kids' college, things like that. So Dave's a big fan of long-term care. You do have another alternative that's out there for you as well, and I want to share this for you, and Tony and his team can help you out. There's an NCRGEA endorsed tax-deferred asset protection plan that has no medical qualifications whatsoever. It allows your money to grow with the stock market if it grows. If the stock market drops, you don't have any losses in there. But what I like about it are the built-in long-term care benefits. This is the plan that I have because of my father's history of dementia. It makes it difficult for me to qualify for a long-term care plan. But I have a plan, have this plan here, that if in the future I need to take out money to use for my long-term care, I can do it without any penalty. And if I'm already taking out money periodically and have to be taken care of in a nursing home facility, it will double my payout. So I've got peace of mind knowing that if my wife and I need long-term care, we've got coverage for it. But if we don't, I still got this money I can use however I want to. So there's a lot of flexibility of options that are out there for you as well. So now it's up to you. You get to decide. I'm going to give you a quick call to action. If you have a long-term care plan, review it. Let Tony and his team review it. You see that link down there at the bottom? I'm going to show that to you in just a moment. Again, you can write that down. Tony and his team can review that for you. If you don't have a plan, think how you're going to pay for it. Determine what your best course of action is. Now's the time to take care of that. Give yourself peace of mind. AMBA can have alternatives. We have traditional long-term care plans, and then there are about 4 or 5 other plans that could be less expensive depending upon your age, medical conditions, things like that. There's a lot of options out there, but you can go to amba-review.com/NCRGEA and find that out for you as well. Real quickly, before I open it up for a couple more questions out there, don't forget about your free benefit, the Passport program. This is dining, shopping, travel, golf, football tickets, basketball tickets, restaurants, so much stuff all across the board. It's free for you. Tony and his team can help you learn what's out there for you because there's lots of ways you can save money out there as well. So are there any questions that I can answer? If you'll put those into chat, and if it's something we haven't answered, Tony or Daryl or someone, we can answer that. Or you can take your smartphone, grab your smartphone, open up your camera, and hover over that QR code. If you want to hover over that QR code with your smartphone, open up your camera and don't take a picture, hover over it. A little form will pop up. You can say, I want to talk about long-term care. I want a benefit review, whatever it is. Fill it out. It'll go back to Tony and his team. Will contact you, say, hey, thanks for being on the webinar today, the Lunch and Learn from NCRGEA. How can I answer questions for you? Walk you through that. If you don't feel comfortable or you're on your smart device right now, you can call Tony's team at 833-347-1764, or you can do amba-review.com at NCRGEA. So again, we can help you out there. Tom, Daryl, have there any questions come through here that we need to answer that we hadn't answered today?
There are quite a few, but thanks for all that good information and about long-term care. I'm sure a lot of people saw some information that they had not considered. Speaking from personal experience, I took out a long-term care policy on my wife years ago to ensure her needs were met as she grows older. I myself am looking at the VA. Right now, we do have a few questions our members have asked. If there are any that cannot be answered, we'll ensure we receive a follow-up communication that addresses those responses. So Daryl, do you have any questions?
Well, I think there's one. Someone asked, is there any financial help for long-term care?
That's a great question. The government has done some things in the tax laws that allow you to utilize pre-tax money or purchase plans with pre-tax money. So if you have like a health savings account, you can do those things. There are also the benefits that you receive from a long-term care plan are tax-free. And then there are some, and I'm not an accountant, so don't quote me on this, but whenever you do your taxes, they'll talk about some of these things that you can deduct from your taxes. That's about as far as the federal government has done to endorse long-term care and those needs. Some states, and I don't think North Carolina for sure, some states are putting in long-term care plans that you could buy into, things of that nature. Very rarely do I see, because it is so expensive, and it would be a significant burden on a state to do that as well. But that's a good question, but right now there is not. You may find some subsidized nursing homes, subsidized adult daycare facilities, things like that, where if you had a smaller plan plus use these subsidized facilities, you could make your dollar stretch more, something like that. Good question.
Okay. So another one, and Tony may have answered this one already, regarding the difference between long-term care, the terminology, and extended care. And I know you said something about that, but that was another question that someone had.
Great question. And that's why you're going to see long-term care as an overarching umbrella that includes extended care, custodial care, short-term care, home health care. It's all multifaceted. So you will hear different policies, different terms used, things like that. It's all under the long-term care umbrella. The most important thing is when you're thinking about it is do I have peace of mind that I'm going to be taken care of how I want to, where I want to, and as Tom mentioned, in the manner you want to. We get a lot of questions, especially in North Carolina, about VA benefits. The VA care is excellent for long-term care. The challenge that I have seen is sometimes that waiting list is long to get into a facility. And so sometimes that burden falls on a spouse in there. I think there are some plans that the government will pay some of that money towards a caregiver at home, things of that nature. So we've seen some people that will buy a short-term care plan, for lack of a better term, that maybe would cover them, like my mom, for a year while they're waiting to get into a VA facility, that type of thing. So good question. Good question.
Another question, which I'm not sure how you can answer it, but they're asking what kind of cost range is there for long-term care policies?
Okay. It's across the board. There are so many different types. So, I mean, a long-term care policy, a traditional one, like I showed you with the hamburger, that's usually the most expensive because it's the most comprehensive. Then there are shorter terms, like my mother's. That's the one I'm most familiar with most recently. When she bought her, she was 81, and it provided her $1,000 a week worth of coverage. And it's somewhere in the neighborhood of $135 a month, something like that. So like I said, it gave my brother and I peace of mind knowing that she'd have at least $50,000 of coverage for the first year, that we could take care of her while we're getting her affairs in order. And so I've seen some long-term care plans that could be $300-400 a month, depending upon the amount of coverage they purchased. And I've seen some short-term policies that cover just the 90-day elimination period for as little as $50 a month. So, I mean, it's all across the board. It's a great question, Daryl. Thank you very much for whoever submitted that. Tony and his team are able to cover all of those aspects with you. Now, Tony, if you'll unmute for me, and if someone uses this QR code, calls the phone number, uses that to link their amba-review.com, and they get a hold of you, what is that conversation like? How do you call back, identify themselves, that kind of stuff like that? What does that look like?
The first is we would go over what their needs are and budget, and then also their medical history, the prescriptions that they're taking, because the insurance protection for long-term care is the most affordable if you get it when you're as young as possible and as healthy as possible. And so we would determine which of the endorsed benefits they would be eligible for, and then explain those to them and let the people choose which ones that they would like to apply for. And then we'll see if the companies if they can get accepted for those.
Super. And you can do this on the phone or in Zoom, or how do you do this?
Right. Yeah, we can do it right over the phone. We can do it in Zoom. They're not locked into anything just to find out whether or not they're eligible for the benefits. They can find out and then decide at a later time if they would like to take advantage of it or not. We're just in charge of helping them decide which ones would probably work the best for them, and which ones are available for them depending on any pre-existing conditions.
And if somebody has an existing long-term care policy, is your team trained to review that and kind of show them where their opportunities may be?
Yes, absolutely.
Okay, super. Thank you, Tony. Appreciate that. And you've got a full team that's available to answer calls all throughout the day. The phone number's there, as well as use the QR code as well.
Right.
Daryl,
and anybody who watches this later on the recording can use that same number, because we're there Monday through Friday.
Great. Daryl, any other questions that have popped in that we need to address before we wrap it up?
A couple of questions around protecting assets of family members. And so that might help with a couple of questions. And then I'm going to suggest that folks contact us as well.
Exactly.
Of any, for any answers to questions that they have, and we'll reach out to you all. But the asset question, protecting the asset is important.
I'll answer this two different directions because it could have been coming from two different directions. I'll answer from the Medicaid situation first. The way Medicaid works is they will do a 5-year look back, meaning that if you try to qualify yourself or mom for Medicaid to get into a Medicaid facility, part of that process is they're going to look back 5 years and say, did you try to hide assets? Did you take a bank account over? Did you sell land? Did you put it in somebody else's name? So you've got to be pretty sharp to think, I can do this and then wait it out 5 years and then mom's going to need care at that point. So Medicare is pretty smart in trying, or Medicaid, I'm sorry, Medicaid is very smart in trying to figure that out. That makes it difficult to qualify in that regards. The other path that we could go on and talk about protecting assets was like as I mentioned with my father. In the same way for all of you, you've worked all of your career. You've worked to provide for your family. You've worked to prepare for your retirement years. Why would you let a medical need, a healthcare need, eat away at those retirement savings and protect the assets that you've saved up for a spouse? Maybe something you want to give to your kids or grandkids, family land, something like that. A good long-term care plan can protect your assets so that you can leave that legacy to your family. Or in the case of my father, he could leave the house and make sure that my stepmother was able to live in the house accustomed to the way she was and not have to worry about anything. So that could have been where the question come from, two different places, to look back on the Medicaid or just the protecting of the assets that you've worked for. Because it doesn't make sense to me to work as hard as you've worked all of your career to serve the citizens of North Carolina, to then have someone else determine how you're going to be taken care of, where you're going to be taken care of. You want to have that control and peace of mind. That's why you're a member of NCRGEA. That's why they've partnered with the AMBA to make sure you've got that peace of mind. So thank you all very much for being here. Tom, Daryl, thank you so much for allowing us to be with your members today. Again, we're going to leave this screen up here and I'll let Tom wrap it up. And thank you all and have a tremendous rest of your week. Take care.
Thanks, John and Tony. Appreciate it. A lot of good information was provided in that, especially in the questions and answers. Folks, speaking again from personal experience, one thing I'd recommend, go to a facility that has private care and Medicaid and just take a tour. And then you can start to see what Medicaid will provide for you and what you may need, you and your family may need to provide for you. It can be an eye-opening experience. But that's it for our questions at this time. If you have a question that you think of later on, just send it to Daryl Davis Fulmer at DERYL@NCRGEA.com. That's Daryl at NCRGEA.com. And we'll get an answer to you shortly. Don't forget to complete the survey that's posted in the chat. It'll also be included in an email we'll be sending to you later today. Again, it's quick and easy to complete, and please have the responses back to us by Monday. Before we leave, we want to let you know about our next Lunch and Learn webinar in November. Our friends at the State Employees Credit Union will be giving a presentation on estate planning. It'll be held on November 8th from 12:30 to 1:30. Katie Kearns and Blake Agnew from State Employees Credit Union Financial Advisory Services will be our presenters. Registration for this Lunch and Learn is now open. The link for the registration will be in the email we send to you today and by going to our website calendar. Just once you get to the calendar, go to the link on the November 8th entry. Thanks again for joining us. And as always, the association stands ready to assist you in your retirement. Thank you. Goodbye.